In the mouth. Okay, we'll go ahead and get started. I guess that's all everybody's coming. But today we got bloodborne pathogens. Scott promised he would keep it short. You could give him your full attention.
All right, well, good morning, and appreciate your time once again. And as John said, we're going to talk about bloodborne pathogens, bodily fluids, that sort of stuff. Real exciting stuff, so that ought to keep your attention. Really just got to ask yourself a question, from a occupational exposure point of view, could you contract a disease at work by, various different types of tasks that you may do? Could you get a disease from administering first aid? We hope to answer that question here. Post-accident cleanup. Using a tool covered with dried blood. Could we pass on disease by just throwing tools back in the toolbox after we've cut ourselves with it? What you'll see here in the kind of yellowed italicized language is it's language out of the George Cook Sons bloodborne pathogen policy. So I wanted to interject some of your exact language from the policy. And basically, the people at George Cook Sons that have been identified as people who have potential to have occupational exposure to this is all designated CPR trained team members and all designated first aid trained team members, field service team members, and manufacturing supervisors and team members. Manufacturing supervisors and team members. Those are the people that are going to be providing aid if somebody gets hurt. Those are also the same people that should be cleaning up the post-accident cleanup, that sanitizing the blood and bodily fluids that might be in the aftermath of an accident. OSHA requires us to, we're going to talk about the basics of bloodborne diseases, and then more importantly, the exposure prevention. Let's first define what is a bloodborne pathogen. It's a microorganism. It's present in human blood. We pass it on to each other through blood-to-blood contact. Okay, and that's important to understand, that blood-to-blood contact. And I'm going to say that a couple of different times as we go through this program, that because there's always a lot of questions about, if somebody has something and how can I get that from them, or there's a lot of worry about transmission of disease. But when it comes to bloodborne pathogens, it has to be a blood-to-blood contact. Some of the more noteworthy diseases that are passed on through blood-to-blood contact is HIV, the virus that leads to the AIDS virus, hepatitis B, and hepatitis C. Certainly not an all-inclusive list. There's hundreds, if not thousands, of diseases that can be passed on from blood-to-blood contact. These are just some of the more prevalent and certainly some of the most noteworthy diseases that we have. HIV, most of us are familiar with it. It's the virus that leads to AIDS. What HIV does to your body is it depletes your immune system. Most people don't die from HIV or AIDS. They die from what that does to your body. It depletes your immune system, and then you die from something like the common cold, something that most of us healthy individuals can fend off, but your immune system is so depleted that simple things that we normally would fend off, they get depleted, or they can lead to fatal events. The good thing about HIV, it doesn't survive very well outside of the body, so it tends to die off relatively quickly once it leaves the body. That's a good thing. Saliva, sweat, and tears. A lot of people always wonder, can these things pass on? Can I get AIDS because I touched somebody and they got sweat on me? Most of us probably remember when Magic Johnson announced that he had HIV, and there was a big hubbub in the NBA at that time. And what was that about? Anybody?
Him playing with.
I know you guys too well, and I know you're not that shy. They were worried
Yeah,
about sweating, you know. I mean,
contact.
NBA players sweating, they're rubbing it up against each other, and of course that was an earlier time with HIV, and we knew less about it at that time, and people were afraid that they would get HIV from getting sweat on them. And the reality is that saliva, tears, sweat do not have bloodborne pathogens in them. Now, the simple reality also, though, is that we really have no way of knowing if that saliva, sweat, and tears aren't carrying some blood with it. So, in that vein, we're going to always practice universal precautions, and we're going to presume that when we are coming in contact with bodily fluids that they may contain some trace. But sweat, saliva, and tears, in and of themselves, do not carry bloodborne pathogens. Hepatitis B, about 1 to 1.25 million Americans are infected with this. It's pretty prevalent in America. Symptoms are jaundice, fatigue, abdominal pain, loss of appetite, intermittent vomiting, may lead to liver disease, chronic liver disease, cancer of the liver, and can be fatal. A good thing about that is there's been a vaccination available now for a long time, and that vaccine can give you immunities to this one strand of the virus. Now, something to understand is that especially if you've had the hepatitis B vaccine, is that doesn't turn you into Superman or Super Wonder Woman. It's only good, and it's only going to protect you against hepatitis B. It's not going to protect you against HIV. It's not going to protect you against hepatitis A, hepatitis C. It's just hepatitis B. So we still have to practice good universal precautions, and we'll talk about universal precautions in a moment. But we need to practice universal precautions to make sure that we're safe, because it's only going to protect us on that one thing. HBV, hepatitis B, it can survive for about a week in dry blood. And so usually in the manufacturing setting, I ask people, I say, now how many of you have cut yourself with a tool and tossed the tool back in the toolbox? And I'll get a few honest ones that raise their hand. If we've all done that, you know, we've all done it. And I ask, how many people do you think have handled that tool in the week leading up to you cutting yourself with it? And how many people are going to use that tool in the week preceding you cutting yourself with it and throwing it back in? So the right thing to do is when we have an event like that, is that we sanitize it properly and before we put it back, and that way we're not passing on these bloodborne diseases. And we'll talk about what proper sanitation is in a moment, but we really should be sanitizing this. If you gouge yourself with a screwdriver, we should be using disinfectant before we put it back on in the box. Hepatitis C, the symptoms are very similar to hepatitis B. It's the most prevalent of the bloodborne diseases. There's more people infected with this, and it too can lead to chronic liver disease, and it can be fatal as well. Some of the bodily fluids that we need to protect ourselves against would be obviously blood, saliva, vomit, urine, but we just learned a moment ago that they have to contain what? They need to have blood in them. They might be a good vehicle to drive the blood to you, but they don't have bloodborne pathogens in them by themselves. And I'll throw this out there, and I don't want this to be confused with don't protect yourself when you're dealing with those things, but there's been no reported cases of anyone contracting, hepatitis or AIDS or HIV from saliva, blood, or saliva, vomit, or urine. Okay, but if it has blood in it, it could be something. But we're going to protect ourselves again with those universal precautions: semen and vaginal secretions, skin, tissues, cell cultures that also need to have traces of blood on them in order to transmit. Not really a good idea to share fingernail clippers and things like that with other people, because they could have trace amounts of blood. And any other bodily fluid that could contain blood are things that we need to protect ourselves through universal precautions. Now, what is universal precautions? It says that we're going to treat all bodily fluids as if they're infected. No matter how well you know the person, no matter how long you've known the person, no matter how good of friends you are with the person, you're going to protect yourself as if they have something you don't want if you're going to come in contact with their bodily fluids. Whether that be through helping them because they just got cut or because you're cleaning up after an accident, we're going to presume that they have something we don't want, and we're going to protect ourselves accordingly. And we're also going to do that whether it be first aid or the cleanup and decontamination process. And universal precautions is in your policy that will be practiced at all times. Some of the ways that you could have a potential transmission is contact with another person's blood or bodily fluid that may contain blood through the mucous membranes of the eyes, nose, and mouth, or through non-intact skin. So, getting splashed in the eyes, getting splashed in the nose, getting splashed in the mouth, those are potential transmissions. So, it's not good enough to just have the gloves on. If there's a chance that splashing in the eyes, nose, or mouth, then we need to protect that as well. We need to have the mask, the goggle, or the safety glasses, and the rubber gloves to keep it from all those sources. And then obviously contaminated sharps, whether that be a box cutter in your toolbox or whether it be a needle in a trash. Any of those things can transmit. The non-intact skin, your skin is an amazing barrier and protects you against, the blood-to-blood contact. Even if you get splashed let's say you get splashed with blood on top of your hand. If you don't have a cut, a nick, a blister, a scab, something like that, then you don't have a blood-to-blood contact, and you really don't have much of a risk of it. Instead of going through a lot of blood work and testing to see if there's anything you need, any diseases that were passed to you, really what you need to do is go scrub your hands and disinfect your hands through washing them really well. Potential exposures, the greatest chance you have of that is an industrial accident. And again, whether it's administering the first aid or whether it is, cleaning up after the person's gone, that's the biggest chance of doing it. Janitorial or maintenance work, where that comes into play is sometimes, people, there may be insulin-dependent diabetics that toss a needle in the trash. And if they just toss it in the regular trash and somebody, a janitorial staff is going and cleaning that up, they could get stuck with that needle and have a potential transmission. But for what we do here, the biggest chance is somebody, gets a gash in their hand, finger, and they bleed everywhere, and we have that to deal with. OSHA says that you have to have what's called an exposure control plan, and that's what part of your written policy is all about. The first thing is a potential exposure determination. That's just determining what jobs at your business are at risk of potentially coming in contact with this stuff. Then safe work practices for each of those things, developing, how are we going to protect ourselves and what kind of policies and procedures we're going to do for decontaminating and how are we going to handle the hazardous waste afterwards and that sort of thing. Decontaminating equipment, making sure we have the right stuff, making sure that we've got the right procedures in place for decontaminating. Handling the biowaste, the labels and signs of the biowaste so that we know that we don't put this hazardous waste in normal trash and we don't put normal trash in the hazardous waste, proper signage. And then training requirements and record keeping requirements are all part of that exposure control plan. What kind of protective equipment do we need? Something to understand about the bloodborne pathogens program is that, when OSHA wrote this program and these requirements, they kind of wrote it with the medical field in mind. They wrote it with thinking about doctors and nurses and dentists and the people that work in hospitals. But they didn't put it out there and say, okay, doctors and nurses and people who work in hospitals go follow it and everybody else can ignore it. They put it out there and left us all to follow it. So there's a lot of different kind of personal protective equipment that some people need to wear. We will be concerned about rubber gloves, masks to prevent the splashing in the nose and mouth, and then safety glasses. Okay, that is enough protection for what we plan to do. I don't think any of you are planning to perform surgery out there, are you? I hope not. If we need to decontaminate, we're going to wear the proper personal protective equipment, and we're going to utilize the disinfectant cleaner that is in the body fluid cleanup kits. Does everybody know that you have body fluid cleanup kits located around and where to find them? Did you know that? I see a lot of heads going like this. I see some going like this. If you're one of them that went like this, maybe ask one of them that went like that where they are, okay? So there's a disinfectant cleaner in there. There's other things in there. In a typical cleanup kit, there'll be some absorbent material that you can put on liquid, and it absorbs it up. There'll be a disposable dustpan in there, and scoop to be able to pick up that absorbent stuff. There'll be the disinfectant wipes. There'll be some towels. There'll be a red bag trash in there. So those are some of the things that you should find in that kit to help you clean up the mess. Also, if you run out or if there's a bigger mess, a 1/4 cup of bleach per gallon of water will kill off the microbes that pass on the bloodborne pathogens. So 1/4 cup of bleach per gallon of water is a very good disinfectant for cleaning, mopping the floors up with, or cleaning the tape workbenches, or wherever the bodily fluids went. We have to properly dispose of the contaminated personal protective equipment, towels and rags, and because it becomes regulated waste. It becomes biohazard regulated waste. Some of the safe work practices, we want to remove the contaminated personal protective equipment right away, clean contaminated equipment and work surfaces, thoroughly wash up immediately after exposure. So as soon as you're done, then you need to really scrub up, and properly dispose of contaminated items. And again, just the George Cook Sons policy language is, after removal of personal protective gloves and equipment, team members shall wash hands and any other potentially contaminated skin areas immediately or as soon as feasible with soap and water. Hand washing facilities are readily available to the team members who incur exposure to blood or other potentially infectious materials. So it goes right in line with what OSHA says you need to be doing. Regulated medical waste, we talked about that. Now what they say is, because I always get a question is, well, I have this Band-Aid, and now that you just put me through this training and I understand bloodborne pathogens, do I need to put that Band-Aid in the red bag trash? And what OSHA says is liquid or semi-liquid blood, which basically is saying that if it's so saturated that you could compress it and liquid would come out of it, then it needs to be in a regulated waste bag. Otherwise, it can just be thrown in normal trash. So that's kind of the determining factor. And I don't expect you to really squeeze it to see, but if you think it's probably, hey, if I squeeze this, it's going to drip out. Well, that's when we need to throw it in the regulated waste. Contaminated sharps, maybe broken glass that cut somebody. We need to make sure that gets put in regulated waste. George Cook policy says all biohazardous waste shall be disposed in accordance with local, state, and federal regulations. There are red box containers located in a couple of different places. I know where one of them is out as you go into the panel shop. Does anybody know, is there another one located somewhere else, or is that it?
I think there might be one here in the company.
I would assume that there's one in the office and one out there, maybe one in both shops out there. So make sure that those items get put in there. Please don't put just normal trash in the red bags. It's very expensive to dispose of the red bags, which is fine if it really is regulated waste, but it's very expensive to pay to have processed and you're throwing soda cans and things in there. So make sure that it's only red bag stuff that goes in.
Who are you supposed to notify if you put something in?
I'd call Roger. That's who I would.
So, does it get emptied?
Roger's your
As
safety.
soon as somebody puts something in there, then you call and rid
Um,
of it? How often? Do you wait till it's full?
I mean, I wouldn't just, no, I wouldn't just, you know, send it out every time that something small gets put in there. But I mean, if it gets half full, yeah. Talk to Roger about it. I mean, it's not gonna hurt to let him know, say, hey, you know, I threw some stuff in there, just wanted you to know. He can evaluate whether he thinks it's time to send it out or not. Exposure incident, something to understand about an exposure incident is, you know, when I talked about your skin being a good barrier and you get blood splashed on your hand, if you don't have it splashed in your eyes, nose, or mouth, or get into an open sore, a cut in the skin, it's not an exposure incident. However, if you have an exposure incident, you need to report that immediately. And George Cooksun's policy says when any team member incurs an exposure incident, it should be reported to the Human Resource Department. If there is an exposure to a bloodborne pathogen, the team member will be required to go to Deaconess Comp Center for evaluation. The team member will be offered the hepatitis B vaccine at no cost to him or her. The vaccine will be offered within 7 working days of the initial exposure, unless the team member has previously had the vaccine or any antibody testing showing the team member has sufficient immunity. So you got to report the exposure, and then you go to some post-exposure follow-up. I'm not going to read all that. Basically what the post-exposure follow-up is it's a blood test to determine whether you have, you know, anything that we need to be treating for. And with consent, if we know where the source individual was of the blood, we'll ask them, do you mind submitting a blood test also? We'll test them to see if they have something that we need to be concerned with. If both tests come back negative, that's pretty much the end of it. If we don't know the source individual, then there's usually up to about 6 months worth of blood tests that gets done on you to as things, you know, get past their incubation periods to make sure that there's not something we need to start treating for. Record keeping, just like with all government things, you got to keep records of the hepatitis B vaccines, post-exposure follow-ups, and also the training records and that sort of thing as part of the standard. Just a quick summary. Universal precautions is what?
Treat all fluids as if they were contaminated.
Treat all bodily fluids as if they are contaminated. That means wearing the proper personal protective equipment and following those safe work practices. The proper PPE is the latex gloves, the glasses, the mask. Oh, I forgot to say in the cleanup kit, there's usually a paper mask in there as well to put on. Decontamination, we'll use the disinfectants in the kit, or we can use bleach at what quantities? Quarter cup per gallon of water. If it was me, I'd be putting about 3 cups per gallon of water, you know, just a little extra, but quarter cup ought to do it.
Is that if we were cleaning up after you?
Huh?
If we were cleaning up after you, we'd have to use that many bleach?
Be leery, be very leery. Extreme universal precautions. Exposure incidents, remember that we want to report all exposure incidents. An exposure incident is defined as a splashing of a potentially infectious bodily fluid in the eyes, nose, or mouth, and or a non-intact skin or sharps, you know, getting cut with something that was contaminated with it. Are there any questions?
How long do you leave the bleach water on?
I'm not aware that you have to leave the bleach water on for an extended period of time. I know there are some sanitizers that the manufacturer will tell you to spray it on the surface and leave the surface wet with it for 15 minutes or whatever. If I was really, I mean, if you want to err on the side of caution, follow that, 15 minutes, let it soak, then you can wipe it away. But in theory, it should kill it on contact.
Not that it's gonna happen, but you get a pretty good cut and it makes a pretty good mess. And you don't feel comfortable trying to do the cleanup yourself. Is there somebody you can call, a fire department or something like that, that would possibly come and help clean up?
I don't really have a great answer for that, but the fire department's not gonna come clean it up for you, but.
The ambulance service, or if you have to call an ambulance and haul the guy in because he's cut a finger off and made a mess everywhere.
I would venture to say that lots of the cleaning, industrial cleaning services could come in and do that for you. And they're gonna be trained in bloodborne pathogens and universal precautions and disinfectants. Was there an answer over here?
There'd be a cleaning service that we could call and have to do
Yeah.
that, and we'd get with Roger to determine if we need to do that or not. They'll call and have.
I mean, if he bleeds out on the floor, I ain't touching him.
That's
Yeah. And I would say that's what we should do, if we have a major incident,
Yeah.
if somebody really gets hurt and there's lots of blood around, then just, stay away and we'll get somebody to do it.
Hey, as your safety consultant, my recommendation is to not do that. To not have that accident that causes you to have to. Any other questions? Well, I appreciate your time. Have a great day.
Would, like the funeral service clean up bruise. Like, we've had a suicide dive, like head off.
I mean,
I know there's crews that do. If